My name is Marissa Farantelli, and my health disparity is on suicide among older men. My targeted audience is doctors and those in the medical field, so they have a better understanding on how they can put an end to my health disparity, and older adults so they understand more about suicide that occurs within their age range. What is a health disparity? Health disparities are differences within the healthcare system closely linked to social, economic, and environmental disadvantages among populations that are avoidable. These populations are groups that have systemically experienced challenges when it comes to health based on their racial or ethnic group, religion, gender, sexuality, age, culture, and more. Suicide among older men is considered a health disparity because there is a noticeable difference between the suicide rates between older men and older women, and there are ways to decrease the rates and avoid suicide from occurring. On this slide, a chart of suicide rates is displayed. It displays suicide rates among people 55 and older in 1999 through 2017 in the US. On the left side, you can see 100,000 women that were tested, and on the right side, you can see 100,000 men that were tested. And after comparing both of them, you can see that there was a substantial difference between men compared to women. Statistics explained. Suicide has been an issue for years, but as seen in the chart, suicide rates has been substantially higher for men compared to women. Suicide is the 12th leading cause of death in the U.S. Older adults are only about 12% of the population, but they make up about 18% of the annual suicide rates. Looking specifically at age, suicide rates has been high for both men and women between the age of 55 and older, but especially men. Suicide attempts are riskier and more severe for older men because they are less likely to recover due to their physical frailty. Disparities impact. This disparity is very impactful on not only the victim, but those he is close to. Specifically on individuals, having thoughts of suicide has an effect on how one functions and his mental state. This disparity can result in the end of one's life. On families and communities, those who were close to the victim would be impacted the most. They would have to continue living without the person they love. This could cause issues to their mental and physical health. When it comes to the field of behavioral health, hopefully the field would do more thorough research on how to put an end to this disparity and what specifically factors in the rise of suicide among older men. I hope this also affects them to do further research on other disparities, so hopefully many of them will soon disappear. Social and environmental determinants of health. Social determinants are the conditions people are born, grow, live, work, and age in. Lack of access to mental and physical health services. I feel this is the main factor in why the disparity exists. Many elders lack access to health services because medical bills and insurance is expensive. Some lack transportation, or there are none provided in their area. Income. As one ages, it becomes more difficult to keep a steady income to provide for their family, which can become depressing. Environmental determinants. An external agent that can cause a change in one's health status. Limited access to healthy resources. Older people have more of a struggle being able to find a safe and closed environment to exercise that is fit for their age, and prepare fresh food. Access to drugs and alcohol. Having easy access to substances will only worsen the thoughts and feelings one is having. There is an overlap of social and environmental determinants. More factors that contribute to increased rates in older male suicide. Women have higher rates of depression, so why do males have higher suicide rates, specifically older males? Research has shown that suicide attempts by males likely result in death more than females' attempts because males tend to use more lethal methods. Older males tend to use lethal methods like firearms. Other factors include loneliness. Many seniors live on their own if their partner has passed away or if they do not live near any family or friends. They lack the social interactions and connection everyone needs. Experience traumatic event. After someone close has passed away, one can feel little reason to go on with life if they have no one else. A traumatic event from one's past could also affect their perspective on life. Medical condition. People who have medical conditions could be going through a lot of pain and feel that they are not at the right mental capacity. Major issues. As mentioned earlier, I believe that there needs to be more access to health services for older people, but especially men. Men tend to take less advantage of the services they are provided, and I feel this is based on the standards society has built. Men must be tough, and it is considered weak to talk about feelings. It is also difficult to gain access to health benefits because insurance and even other services like therapy is expensive. I feel when it comes to health, we need to find a way to make it more affordable for everyone. Health services should also become more available in rural areas where many elders live. Strategies to reduce suicide rates. Number one is to provide more resources where people can express their mental state and physical state. I feel the resources that are available are mostly available in more industrialized areas where there are more organizations and corporations. So I feel having them in rural areas where it's more isolated, where there tends to be more older people, would decrease the rates. Number two is to make substances and weapons that can be used to harm yourself more difficult to acquire. So in this case, especially when it comes to men, I'm talking about guns, drugs, alcohol. Hopefully there's more control on these substances so it's harder for anyone to obtain. Number three is to make health services easier to access by lowering the prices of insurance and resources. I feel that people tend to focus more on money than the well-being of their patients and their health. So I feel that if the insurance and resources that people needed to help their health was decreased, then there would be also a decrease of rates. And lastly, number four is doctors should thoroughly check on their patients' well-being and provide proper resources if necessary. It's the doctor's duty to make sure that their patients feel that they're being heard and that everything is okay. And if they feel any suspicion, then it is their duty to report that and get them the help that they need. My conclusion is overall, health disparities are inequities that occur among mostly minorities and are avoidable. After conducting more research about suicide that occurs among older men, I see how our society lacks many resources needed for our health and the difficulties it takes to acquire health benefits. Hopefully, we will conduct further research on how to end health disparities and put those tactics to actions. Everybody should be treated equally, especially when it comes to health. Thank you for listening to my video, and hopefully you learned something new.